So this week we're basically going to start off by having a look at a bit of microbiome, which you guys probably heard me and Jess talking about before. So Jess and I will pretty much be taking you through this, and then Jess will be covering a bit of cellular response to injury as well. So we're pretty much going to finish all this topic except for like 2 slides, which you guys will do in an active learning later, but it's not too big. So let's get started. All right, so to start off with, we'll be basically having a look at the difference between prokaryotes and eukaryotes. I'm not going to go into it too deeply because you guys have already done this in like the very first lecture of med. But again, just know that your prokaryotes are your bacteria mainly, and your eukaryotes are like us, protists, animals, plants, just everything. And your viruses don't fall into any of these 2 categories. All right. Again, you guys have already done this in immunology, so that's really good because there's like a lot of overlap. I think the main takeaway message from this slide is the thing about sterile areas in our body, because that's quite important, and I've seen that come up in questions before. So your sterile areas are like your brain, your blood, your cerebral spinal fluid, so your CSF, your lower respiratory tract, your upper urethra, and your kidneys. These are all your areas that are sterile. But yeah, so you pretty much just have to remember these, because I've seen questions which are like, is your upper respiratory tract sterile or not? And then you just have to like find the odd one out. Alrighty. Okay, so here are some normal flora examples. We're going through these slides quite quickly. Again, it's not that interesting, to be honest. We've just highlighted or bolded the ones that we've seen come up a lot. So for example, Staph aureus comes up literally every question. Strep viridans is literally any question about dentistry, about the mouth, it always comes up. So we've just bolded the questions that we think pretty important, and the ones that we've seen come up quite often as well. So here they are. Alrighty. Okay, so in terms of relationships with parasites, we've got 3 main relationships that you guys will pretty much have to know. So there's mutualism, commensalism, and parasitism. So they're quite easy to understand based on their name, to be honest. So mutualism, mutual benefit to both the host and parasite. Commensalism, one of them benefits, but the other one, they don't even know that it's there because there's no harm done. And parasitism is when the parasite benefits at the detriment to the host. Alrighty, so we'll start off by having a look at bacteria first. So the most important part of the bacteria in terms of like what they want you to know, I believe in Sem 1, is pretty much the cell wall, because of how it helps us distinguish between your gram-positives and your gram-negatives. So your gram-positive bacteria will tend to have like this really thick peptidoglycan layer, which you can have a look at in this little diagram here, versus your gram-negative bacteria, which have this thin peptidoglycan layer. So that's basically the orange and green dots that you can have a look at in the image. So your gram-negative bacteria also have this weird kind of like outer membrane, which the gram-positive doesn't have. And this outer membrane will contain things like your lipopolysaccharides and different lipoproteins. All right, so let's have a look a little bit in the procedure about gram staining, which is quite important, to be honest, and it's something that comes up quite a lot, especially in your active learning sessions. So I'll go through the procedure. It's not too high yield, so we haven't put it on the slide, but like a basic understanding might be better for you guys. So basically you take like this smear of bacterial cells, so that's your sample, and then you're going to stain the cells with this thing called crystal violet dye, and it's usually done for around 30 seconds, I believe. And then what you're going to do is you're going to treat the cells with this compound called iodide, not too important, and then you just wash everything off with alcohol, so usually ethanol or just another alcohol, and then you just counterstain it with this other compound called sulfurin. But basically that's the whole process of gram staining. In the end, so what you'll be left with is either a pink or a purple gram stain. So your gram-positive bacteria will stain purple. This is because the dye, so the crystal violet dye that we've put in before, is actually going to be retained and kept in the structure. So it's not washed out by the alcohol that we put in. On the other hand, your gram-negative bacteria are going to be pink, and that's because your dye is actually washed out with the alcohol. Okay, like just at the end here, we've put the note that gram staining isn't like a one-size-fits-all test. It doesn't actually work for every bacteria, unfortunately. So the most evident, or the most, I guess, the easiest one to remember is Mycobacterium tuberculosis. It has like this waxy lipid kind of surrounding it, and so it keeps out a lot of the steps and the compounds that are needed for the gram staining process, and so it can't actually be gram stained pretty well, like effectively. All right, so here are a couple of our external structures that we have in the bacteria. So in an active learning last year, we did this weird activity where you got to make your own bacteria with these weird structures. It wasn't that helpful, I'm not gonna lie. But here are the main 4 structures that you guys have to know, and these are structures that bacteria use to help them survive. So you've got your flagella is there just for motility. The capsule's there to avoid phagocytosis, so it has an immune function, but it's also got this other function where it actually helps stop the bacteria from just drying out. You've got your pili or fimbriae and adhesion molecules, so these are used for adherence, and this is what causes your biofilm. So biofilm is when you have like a huge group of bacteria that are joined together in like a thick mat, and they're super like annoying and super hard, and they to like get rid of, and they're often seen when we put like external things inside the body, like a catheter or anything else. And then spores basically help the bacteria persist in the environment even after the bacteria has died, because the bacteria can let out these spores, which can go into the environment, and it basically helps it persist in that environment later, even if its main body has died. All right. So all bacteria will be undergoing a process of binary fission. So this is an asexual reproduction process. Here's a little diagram to basically show you the broad steps. I'm not going to go through it because I think you guys also go through it in the first lecture, and it's not too hard to understand either, to be honest. Okay, so we've listed a couple of the medically important bacteria for you guys. So cocci on the sides, we've got cocci and bacilli. So cocci is just your round ones, your round-celled bacteria. Your bacilli are just your rod-shaped bacteria. Again, we've just bolded the ones that are important, but honestly, it's kind of sad, but you guys will kind of have to know most of the stuff in this 4x4 table. But to be honest, a lot of it is just by looking at it. So they'll give you a gram stain and it'll be like, okay, are these bacteria, are they rod-shaped, or are they like circular? And then you can figure out which way it is from there. On the side, we've just got some other molecules that bacteria might have, like coagulase and catalase. So coagulase basically just helps you clump things. It's not that interesting, but it helps the bacteria clump things. And catalase is going to be breaking down your reactive oxygen species into water and like oxygen. And this basically helps the bacteria survive. And so, for example, coagulase is what is actually going to be released by Staph aureus. Alrighty. Okay, so we've got a couple of other slides. I know that it's a lot of just names of bacteria, unfortunately. But like, yeah, this is just what it is. This is microbiome all the time, to be honest. And we've just got some common bacterial diseases acquired. So they're just common bacteria and where they can infect in like what situation. So for example, a bite is like Clostridium tetanus. But yeah. So these are the next 2 slides. Again, I don't think it's that high yield if you have to remember all of them. Just try to remember at the very least, the bolded ones, because I think those are quite important. All right, so we can move on to our viruses now. These are going to be our non-cellular organisms, and so they're super, super small. We call them these things called obligate intracellular parasites. So this basically means that they need to use the host cell in order to multiply. But they can only develop and reproduce in specific hosts. So not every virus can basically go to any host. All right, I have a chat function, but I don't know how to see the chat in here, but that's fine.
It's just Tanya commenting on Staph aureus and how important it is.
All right, yeah. So Staph aureus literally comes in every time. Like you literally see it everywhere. It's kind of sad. But like honestly, for me, like if I didn't know the answer to a microbiome question, like completely, I kind of just went with Staph aureus. Like, that's how important it is. And like 20% of the time, you're going to be right. Okay. So we can now move on to classification. So there's 5 main types of classifications for viruses. Some of these are less used than others, like the host infected, and is like, I've hardly ever seen that, to be honest. But the ones that would come up most often, especially that you spend quite a while on it, at least in your lectures, are your types of nucleic acid. So there's 4 types that we've gotten down there, and you might want to know like a couple of bacteria, viruses that are like fall under each type of nucleic acid. And its morphology is quite important as well. So your shape, your size, your symmetry, and the easiest way that most people find the virus is pretty much like what kind of disease. So like you hear about like Mycobacterium tuberculosis, that's just tuberculosis TB. Okay. Viral replication is what this slide's pretty much all about. So the way that I like to remember it when I was in year 1 was making this weird thing called APURA. I literally just made it up because it sounded good to, or like easier to memorize, I guess. Where everything in the letter APURA, every letter basically stands for a process. So A is for attachment, P penetration, U uncoding, R viral replication, A assembly, and R release. So those are just the broad steps of the viral replication. I won't go into it too deeply because I think it's pretty much all on the slide, and there's a diagram there for you, like if you're a visual learner as well, just to show you how it basically will get into the host cell and then basically start replicating itself. Okay, viral transmission. So there's a number of different pathways through which your viruses can go from host to host. It's not always the same viral infection as well. So there are actually a number of different outcomes that viruses can have once they've basically gone from from one host to another. So for example, number 1, so viruses aren't always going to be successful in infecting your new host, in which case we call it like a failed or an abortive outcome. Acute is where the immune system really quickly is able to identify and effectively clear out the virus and just get rid of it like super quickly, which is what we all want. Persistent, so this is a bit of a weird one, but it's basically where the immune system, so the virus is, it infects the host, and then what happens is that the host thinks that the virus has been cleared, but actually what's happened is that the virus has gone into hibernation in a hidden area of the body, and so it can actually be activated later on in life. So things like chickenpox, which comes back sometimes as herpes, or chicken that comes back as shingles, or herpes always comes back. As probably if anyone has heard of it, herpes always comes back. A bit sad, but yeah. The other, so 4 and 5 are pretty self-explanatory. Number 6 is quite interesting. So it's oncogenesis. So viruses like HPV can actually cause cancer. So HPV usually causes cervical cancer, but there's quite a lot of other things as well. The scary part is that apparently most people will be infected with HPV. So that's lovely to know. All right. So here's again a list of our medical important viruses. To be honest, this again, it's not that interesting. I think the main takeaway from this slide is that there's antigenic drift versus antigenic shift, which is kind of an important concept to understand. Again, you guys do this in like a microbiology or anything. But basically, your drift involves your small changes in genetic makeup, versus your antigenic shift is like a huge and large scale abrupt change. And these are mainly seen in your influenza virus, which is why you have to get a flu shot every year. All right, so we'll power through. So we're going to move on to fungi next. So fungi are your eukaryotes. Most of them are not actually pathogenic, which is quite interesting. But like some of them can be, especially in certain situations. So they have like an unusual cell wall. So their cell wall actually contains compounds like chitin, these weird things called beta-glucans, and ergosterol. And there are also 3 basic classes of fungi. So you have your yeasts, your molds, and you also have diamorphic fungi. So I've got them on the slide here for you. I think it's good if you have a look at images of them, especially because that will basically help you to figure out what they look like differently, and just memorize 1 or 2 that fall into each class. Okay. Cool. So this slide basically quickly details over the relationship that this one fungi that your lecturer would have talked to you like ages about. Like I didn't understand why she spent so much time on this. Called allergic bronchopulmonary aspergillosis and allergic like allergy reactions, especially type 1 allergy reactions. But I think the important thing is to note that especially in patients with illnesses that already compromise the lungs, like cystic fibrosis or asthma, this is when ABPA can cause a very severe illness because the lungs are already vulnerable. And ABPA will basically be colonizing the lungs. Okay. We've also got a number of different invasive fungi of importance. So there's invasive, subcutaneous, and cutaneous, and these are basically just high yield, unfortunately, just knowing the difference between them and knowing an example. So for example, the subcutaneous, a lot of these examples are super random, as I was talking about with Jess before, but for example, subcutaneous is literally like rose bush injury. So it's when it's literally a rose thorn. You get pricked by a rose thorn, and then you get this weird thing called sporotrichosis, and we just call it rose gardener's disease. Like there's really different and really weird examples, which I think helps you remember it, especially because microbiome isn't the most interesting of topics, I'm not going to lie. But yeah, okay. We'll keep going. So these are the invasive fungi of importance. So the cutaneous and subcutaneous, there's not too many that you need to remember for them, to be honest, but invasive has quite a few that you guys will have to remember, unfortunately. So here are 4 basically your invasive fungi of importance. Unfortunately, there's a quite high yield and any of them can come up. So for example, last year I did message our AC rep and he was like, yeah, unfortunately, you've got to remember them. But the good news is if you remember like 80% of the stuff on this slide, you should be good to go for your exams. Okay, so we'll move on to parasites and have a quick look at parasites. I don't know if you guys have covered this yet, but we'll go through it just for completion's sake. Okay, so just an overview on what parasites are. So these are just organisms that live together, live inside a host at the detriment of this host, basically. So protozoas are a type of parasites, and there are 4 main protozoas from the lecture that you guys will have to remember. So you guys will get like a huge list of parasites, and basically you won't have to. Yeah, you'll only have to remember a couple of them, to be honest. Okay, so let's keep going. So we'll move on to the helminths that you will have to remember. They're just essentially just worms, and they live on the skin. Just remember what the broad classes are, and maybe a couple of examples should be good for exams. So you've just got nematodes, cestodes, trematodes. These are really gross to look at, to be honest. Like you can have a look at it if you want to, but Google imaging them, like they're gross. But I guess that's will help you remember it as well. Okay. I think one of the things that your lecturers also do is malaria. So they go through malaria quite a lot, and you have to go through the life cycle of malaria as well. Again, you don't have to remember too much of it, but I think the most important thing is knowing that there are 5 species, and then all of them start with like Plasmodium, falciparum is your most important one because it's your biggest killer. And the reason because it's your biggest killer is because it can basically have a super high parasitemia, which is basically they can make a really high, there's a really high presence of your parasites in the blood, which makes it like basically your load of the parasite is super high and it causes your system and your body to be overwhelmed. It can also cause this thing called rosetting. So rosetting is this kind of mechanism that where the parasite will basically cluster unparasitized cells around the infected ones. And so you get this huge lump in your capillaries, which obstructs your blood flow. And this is really bad, especially when you've got like blood vessels in the brain and you're just blocking the blood flow to the brain, which obviously means you'll have oxygen deprivation there and everything. Yeah, so unfortunately, there's not a lot of things that we can do for malaria, as we know it's one of the biggest killers in the world. So there are over like 200 million cases per year. But yeah, so you diagnose them. There's the diagnosis, the prevention, and everything there for you. That's not that important. I think the main one is to know the P. falciparum, and why it is just so effective, more effective than the other four. Here's the life cycle of your malaria. So this is quite hard to understand, I think, from the diagram. So I've just listed a couple of steps there for you, because I remember I took ages to try to figure out what was happening in this diagram. So hopefully if you guys read through the steps, it will help help you guys just understand a lot of the confusing jargon, and just help you guys understand what the hell is happening in this diagram, to be honest. Okay, and lastly, you've got your medically important parasites. Again, these aren't that important. They are quite important, sorry, but they're really weird. Like you've got your Toxoplasma gondii, which is like kitten feces. Like it's not cat feces, it's only kitten feces. And they're really weirdly specific as well. So if you guys will just have a look at them, and just remember there's usually like a couple of buzzwords, like Toxoplasma gondii is like your kitten feces, or Trichomonas vaginalis. So vaginalis kind of stands like vagina, so it's an STI that only affects women. And so there are a couple of things which just help you go through and just, I guess, associate a term with each of them. But yeah, that's it for me. So Jess is going to take you through the last bit of microbiome, and then she'll take you through a bit of just cellular components of injury and everything like that.
Okay, just wanted to also flag Giardia as something that's fairly important, I think. It does come up a number of times, especially because it has that classic like greasy stool, because you've got the protozoa covering the inner like surface of your GIT. So yeah, greasy stool is probably the keyword for Giardia. Other than that, Faisal covered everything, and I will move on to methods of control. So, in terms of like the actual like control method, you have this chain of infection that they like to talk about a lot, because it's like only with this chain being complete can things move around and infect other things. So it kind of makes sense. You need the agent. You need somewhere where like the microorganism lives. You need somewhere where it can enter. You need somewhere where it can exit. You need like a medium in which it can travel through, and you need the host to be susceptible to this microorganism. And to control like the spread of things, you need to break this chain, and that's what they refer to a lot of the time as well. Okay, so the actual control of microorganisms, there are 3 steps, and each step is like a progression from the next one. So you've got cleaning, disinfection, and sterilizations on the next slide, but we're just going to go through these 2 for now, and I'll do that one later. So cleaning is the one that's like super basic. You're just removing some moist material. You're basically just like wiping it down, and it's used for like really not critical items, so things like a bedpan. And you need to do this step before you sterilize or disinfect, just because you're removing like the visible stuff on the item. So the next step is disinfection. This is used for, so this is the one which kills most organisms, and it's used for semi-critical items and non-critical items, and I've defined them here. So things like stethoscopes, your BP cuff, and endoscopes. Like I would have thought it's like kind of intense, but I guess because it's just contacting your membrane, it's not too bad. So you can just use disinfection. So some agents that help you disinfect items would be like boiling water, antiseptics. So this includes stuff like chlorhexidine, like the hand hygiene. Oh, you guys haven't seen it in person. Well, it's a really iconic pink hand wash. Okay, and you can also use this like disinfection for things that don't penetrate the skin. Although it also is like non-intact skin, so I don't know, it's a little bit inconsistent, and the slides are also high-key kind of inconsistent. So I think just getting the general idea that it doesn't kill everything is probably good enough, and getting like a brief idea of like what can be disinfected is probably also worth knowing. And you can also disinfect by using UV radiation, and this is not that good because you're literally just shining some light at it, and so it basically just disinfects your surfaces and like the air. Okay, so the hardcore, like we're nuking everything, is sterilization, and this kills everything that's alive. And this is for like critical items, so anything that's entering sterile tissue. So if there shouldn't be a microbe there, then you should be using sterilization to make sure that if you're cutting into something, you're not introducing like bacteria or any other microorganism. So things like needles and scalpels, and that makes sense. It needs to be like super clean. So some ways you can do this. We've got moist heat sterilization, and we've got like a bunch of these numbers, and the PSP for our year told us to remember them. So I think a number of us did, and I think it might have come up in like one question. So you can go and remember these if you want to. It could also be one of those things like fun facts that you just remember like 2 minutes before your exam, and pray it doesn't come up. So I don't know, it's up to you. But I think they apply pressure in like sterilization so that the boiling point of water increases, which is why you have like temperatures higher than 100 degrees in the moist heat one. So this one is good because it can kill spores, and it's usually, I think, a little bit more effective than dry heat sterilization, which is just a big oven. So yeah, it's a high key is just an oven. If it's you just put it in for like either 170 degrees or 160 degrees for a different amount of time. And another thing that you can do is gamma radiation, and that uses free radicals to break down DNA. So because you're not applying heat with this one, you can use it for things that can't take heat very well. So like I'm guessing that's like plastic, which you probably shouldn't heat because it could probably melt. And the last thing is filtration. And this one definitely struck me as a little bit weird when I first learned about it, because you're thinking like, how do you like remove all the organism with just like some filter paper? But I think it's some like top-notch bougie filter. So it physically removes all the microorganisms from the liquid or gas, whatever it is that you're filtering. And I think it's got like really small holes to make sure that then you're not letting through anything that's alive. And this is like a physical block, so it's a little bit funky. Okay, so some chemicals that you can use for disinfection. So again, disinfection is the one where you're not killing everything, you're just killing most things. These are listed in the slides of your lecture, I think. And it's just like a brief overview. I don't think it's worth like really going in and trying to remember all of these. Like some of the more important ones that we do come in contact with are probably like iodine, chlorhexidine, and alcohol. But it just sort of makes sense, I guess. If you watch enough like medical dramas, I feel like you might just know these. Okay. So some common infections that you can get in the body. So I think Faiza talked about this briefly, and just like Staph aureus, it's everywhere. You just all the time. So these nosocomial infections are the ones that you obtain in hospitals, and like these 5 are like important because they can infect like a number of systems. A lot of them have like resistance to drugs, and they also pop up a lot in hospitals. And you've also got infections that are very common, and this is not necessarily in hospitals. I think this is just general. Oh, maybe it is also in hospitals, but these are like the more common ones that you get, and they don't necessarily correlate with exactly the list above, but the list above can lead to the infections here. So you've got like urinary tract infections, which are like super common. Um, I think other was like the second most common. So there's just some bunch of other stuff that can also happen. So yeah. Yeah, I think the main thing is just Staph aureus. It really is the answer to literally every question. Okay, so diagnosing infectious diseases. So this was like I think this was like a pre-reading for us, and all of us were like, "Oh, surely we don't need to know that." And it came up in some of the questions came up in the exam, so we were like, "Oh shit, okay." But I will just run through them real briefly. So you've got a bunch of ways to diagnose things. So you've got direct light, where you're just shining light at like the sample, and the sample doesn't have to be alive for you to be able to see it. But because it's just like light, you won't be able to see viruses, which are really small. You've got microscopy, which is where you fire a beam of electrons to like at the sample, and you can see the microorganisms with that. And because this one's a little bit more, this is like smaller, you're able to see things like viruses, and you can also see like things that are not alive. Actually, yeah, it has to be not alive for you to see it. Okay, and you can also culture bacteria or fungi, and you just grab a sample of that and grow it onto like an agar plate. You can do serology, where you grab some blood from the patient and you look at the serum to see if they have the antibodies for something. Ribotyping, you extract DNA and you look at the strain that you have. PCR, I think this would have been covered in like genetics or biotech, but you basically take a bit of that DNA that you're looking at and you copy it a bunch of times. And because you've got a bunch of copies, you can then identify like what it is. And this can either be like a sample that's alive or not alive. And they've got MALDI-TOF with mass spectrometry, which looks at the mass charge ratio of like any molecule. And if it has like a unique protein structure, that can usually be picked up if you like analyze the sample. And I think you can correlate that with like a specific bug or whatever, like microorganism. Okay, so these are so dry, but okay, precipitation reactions. You've got an interaction of your antibody and antigens, both of which have to be soluble. And once you react them, they come together to form an insoluble precipitate. And because you see this happening, you can conclude that you've got that thing there. This one's less sensitive than agglutination, which works like high key in a very similar way, because you're reacting antigens and antibodies again to form a visible aggregate, but just know that like the agglutination one's a little bit better and more sensitive. Fluorescent antibody techniques. So this is the one where you just track some like fluorescent staining with some dye on. And I think certain microorganisms can like pick this up and it will like glow if you like look at it. It's kind of weird, but I think it helps you like set apart different species from each other. And then you've got ELISA, where you have an antigen on a solid surface and you have it react with like an antibody with an enzyme. It's like a bunch of different steps and it's like kind of hard to understand, but I think it helps you just identify like what antibody antigens are present. Okay, and Agar plates. So this was something that I think a bunch of us learned like the night before the exam, and we were like, "Oh, surely this is just some like no one needs to know this," and it came up. So I think the only one you really need to know is horse blood agar. So it detects the hemolytic activity of the microorganism that you're looking at, which basically means that does it break red blood cells down or not. So you've got three different types. You can have beta hemolysis. Oh God, words. Which means that the bacteria is able to completely lyse your red blood cells and completely digest everything in your red blood cell, which means that the plate, which is covered in red blood cells, you're going to have lightened zones wherever these bacteria are. So strep pyogenes is classic for like being like beta hemolytic. And you've got alpha hemolysis. I also don't really know why like beta, alpha, gamma is like not in order, but that's okay. But alpha hemolysis is a partial lysis of red blood cells, so it only breaks down like certain bits of it. And because you've got this like breakdown of only certain bits of it, you have like byproducts of this breakdown, and these are like green brown in color, which is why you get green brown zones. And lastly is gamma hemolysis, which means it doesn't have any hemolytic activity. It's unable to break down these red blood cells, and you don't get any change on your plate. Some other plates that I think we were taught about in first year are TCBS and Subarad. And I don't really feel like you really need to know this, but they're just on the slide for completion's sake in terms of like learning the Agar plates if you really wanted to. Okay, right, hopping back into immunology. So we're going to be looking at tissue response to injury. I think this was like one active learning. Okay, so it looks at what your cell does once it's been injured. So this like brief overview kind of diagram shows that you can either go into like reversible injury where it is able to return back to normal, or it goes into irreversible injury where the cell dies either by necrosis or apoptosis. So a couple of factors which affect the outcome of the pathway in terms of like whether the cell dies or not is that, well, the cell, yeah, like how the cell responds to this injury. There's three here that I've listed. So the amount of damage, the type of tissue, and duration of injury. So I think all three of these are fairly self-explanatory, and that if you have more damage, if you have less tissue that proliferates less, and you have a longer injury, that's going to lead to a worse outcome. So the types of tissue, you've got labile, stable, and permanent. It's probably worth knowing like which ones are like the examples that we've got, like skin, pancreas, or brain. And they also sort of just make sense. Like if you scratch yourself in your skin, it's likely to just heal because your skin cells are always regenerating, whereas with your brain, less likely to regenerate or replicate. And the outcomes that you can get are one of three. So you've got regeneration, where you have your normal tissue restored. So that's just like the same as what was there before. You've got adaptation, which is the growth of changed cells. So both these two are technically reversible. And so the different types of adaptation you can get are hypertrophy, hyperplasia, atrophy, and metaplasia. Hyper, that like little first bit just means increase. And I'm guessing trophy is like cell/organ size, because that makes sense for both A and C, which are hypertrophy and atrophy. And then hyperplasia, increase in cell number. And you've got metaplasia, which is like completely like a little bit different from the first three in that like your cell morphology is changed, but I think it's still the same cell. And then repair is the last one, which is the irreversible outcome, where your cell dies and you get the growth of like completely different cells in that region. Okay, so with cell death, so when the injury is reversible, as you can see from like the outcome diagram that was shown earlier, when the cell dies, it can either go into apoptosis or necrosis. So if it apoptoses, that's like the normal pathway that a lot of cells usually take anyways. So it's a normal process. It's like programmed cell death. It's very regulated, controlled. It like apoptoses by like breaking down inwards, so it doesn't like explode. It like low key implodes, but it doesn't affect like the other cells around it. Whereas with necrosis, it's like a bunch of cells dying together. It's usually caused by like injury or pathological stimulus. It's not like programmed or anything by the body. And because you've got this premature cell death, and it's like it's exploding outwards, you release a lot of inflammatory content, and that can lead to some really terrible outcomes. And there are a number of types of necrosis that we've outlined here. This was also like one active learning, I think, and they showed us some really gross photos of like necrosis, and it was kind of not it. But we've like summarized what it looks like, and these are like keywords that probably should be remembered. So liquefactive is the one that's associated with the brain. It looks like spongy and is not very firm. But caseous necrosis, which is in the lung, it looks like cottage cheese, which is super nasty. Fat necrosis, in which the tissue that is usually there has become like adipose tissue. You've got coagulative necrosis, which occurs when you've got like ischemia and the tissue dies because of lack of oxygen. And that's usually found in the heart. So healing processes. Okay, all these slides are a little bit like over the place just because we're trying to tie off the like last bit of immunology, but yeah. So first intention is the one which you're trying to strive for when you've got like an incision. So you try to put the two like clean edges together, and just to like put that together so that it can heal nicely. So in terms of like the numbers that we've quoted here, once you've sutured it, it's like healing. And when it's mostly healed, the sutures are taken out, and it becomes 10% of the strength of what the skin used to be, and like before it was cut. And over time, this gets stronger as it like continues to heal. And at the very end, like I think it only ever reaches to 70% of the original strength of like normal skin, which is still pretty good considering you like cut straight through it before. Second intention is the one that is a little bit more worrying because it's like extensive damage. Rather than having like a clean cut where you can have the edges meet, you've got like basically like a crater in your skin. And so for this to heal, you have like a combination of both regeneration and scarring, and it needs to heal from bottom up for it to like heal sort of properly, because you've got all the like blood supply at the bottom, and because you don't have these edges, you need to be putting together a lot of extra stuff for the wound to not be like a gaping hole. So you've got the formulation. So okay, so for this to happen, you need to like pack the wound to help it heal from bottom up, and like the steps that occur are like granulation tissue. So you've got the development of capillary endothelial cells, and that helps with like the laying down of like fibroblasts and all that, and that leads to like fibrous tissue being laid down as well. Okay, so types of inflammation. So you've got two types, so acute inflammation is like the more normal one. It's the one where you just have neutrophils coming in and at the site of injury, and you're just trying to clear out like whatever is causing this damage. Like, so if you've got damage in tissue, you've got like invaders, and the tissue injury here is fairly limited and it's over a fairly short period of time. Whereas with chronic inflammation, it's very much like disordered. You have like loss of function. It's happening over a long period of time. You end up with like tissue injury and tissue destruction. And a key word here, I think, is fibrosis and angiogenesis. So you've got this like destruction followed by like fibrosis and destruction again. And the main main mediator for this is like macrophages, and you just get a bunch of these. So I think the one thing that they like to emphasize is that with acute it's neutrophils, and with chronic it's macrophages. Okay, so some molecules that mediate change. So I think a bunch of these were brought up when we discussed immunology, like for example, like complement, but this is just like an overview of some important molecules in the body that can assist with a bunch of these things. And I think a lot of these you'll come back to over and over, especially because they have actions in the body. They are like targets for a lot of like pharmacological drugs. And you'll come back to these in like Sem 2 in second year as well. So vasodilators, you've got histamine, nitric oxide, and prostaglandin. So these basically just relax your vascular, like your vessels and stuff. And you can have molecules that mediate like vessel permeability. So this is the one which like makes your capillaries and stuff leaky. So it like things like immune cells can move from like the body into like the capillaries, or like vice versa. So then things that can do that are complement proteins, and complement was kind of discussed more in immunology as well earlier. You've got histamine and leukotrienes. You've got molecules that mediate adhesion and attraction. So adhesion molecules, cytokines, and cytokines, oh, they come up all the time. It's just because it's like, not in terms of like exam, maybe like low key in terms of exam, but they come up all the time in terms of like explaining like everything in the body. It's like, oh yeah, that's signaled by cytokines, that's signaled by chemokines. Okay. And like the last one is like prostaglandin. So this isn't like a subgroup. This is just the molecule, and you can see it also like vasodilates. It's in that section as well. But these are directly releasing inflammation, and they enhance the pain signal by facilitating the opening of sodium channels, and that helps with the transmission of like a signal towards like the central system to tell you that, oh yeah, there's pain. Prostaglandins, I think, comes back a fair bit, and I think the next time you really learn about them is when you learn about like pain relief in terms of like pharmacology. So yeah, get keen. All right. We've got a question. Let me see if I can pull up the chat. Feel free to type it into the chat. Okay, nice. All right. Next question. Yep. Oh, I don't know why. We've just lost an answer, but yeah, it's B. All right, I think that's it from us this week. Does anyone have any questions about anything that we've talked about?